Hello. You
Hey,
putting your
everyone.
shoulders back? Better posture?
Good posture in this tight little booth here.
Hope everybody's doing well this week. I was asking Emily yesterday in the office. Emily was sharing stories about all of your travels, and because you traveled a lot growing up because your dad was in the Marines.
I mostly just didn't feel like doing work, so I just started interrupting people and telling stories.
One of the stories I've heard a million times, but it's so good every
You
time.
actually chimed in details of that story that I had forgotten because I hadn't told it in so long.
I've heard it so many times.
I know.
And yeah, and one of the things that came up when you were telling the stories was just kind of around like how we even got started with this concept for naps. This is when you were living in I just remember you telling me this story when you were living in Belgium.
Yeah. I mean, I think first off, many people are always surprised to actually uncover how many places I've lived in my lifetime. And then to 3 high schools. That should be a whole other podcast episode of how horrible I was to my parents in high school when they moved me around so much.
I mean, they kind of deserved it.
They did.
Okay.
They did.
Sorry, Rob. Sorry, Sheila.
Who moves their kid after you start freshman year? I started freshman year in Philadelphia, made the field hockey team, JV, not the freshman team. Like, I was really excited. Had my friends, and then they ripped me out of school and moved me to Belgium, and I didn't even know where that was.
Sorry.
Why are you laughing at me?
Because you're really excited about making the change.
It was like a big deal. And then I was like, where's Belgium? I don't even know where that was on a map. What is that, a state?
The most worldly, least worldly person on the planet.
Totally.
Like, lived in all these places, and you would think you should be worldly.
I actually refused to go, and my whole family moved to Belgium, and I lived with my grandmother.
Yep.
And then finally my parents were like, you have to come. It's not okay. Anyway.
But you need the JV. What team? Field hockey?
Field hockey. Yeah. It's a big deal.
I love it.
Figure skating in the morning, field hockey in the afternoon. Let's go.
Yep.
Anyway, but we were talking about Belgium because when I lived there, I was in high school.
Yeah.
My brother was 2.
Yeah.
So like not even in preschool.
Yeah.
Or maybe like just starting preschool there. He was really little though.
Yeah.
And I remember he was really sick one day. He had asthma as a baby.
Yeah.
And but he was actually sick. Like, he had a fever, he had a cold, and my mom called the pediatrician, and she, to make an appointment, and he was like, I'll be over. Like, I'll be by to the house.
Yeah.
My mom was like, what?
Yeah.
And I just remember this adorable pediatrician showed up, and he had a little black like leather.
It was like, how do you envision it?
Yeah. I know. And he like came and saw my brother.
Still a doctor kit when you're actually a doctor.
It was a leather black bag, like the ones that
I know.
With all the stuff in it.
Yeah.
Yeah. And he came to the house, and I think like my mom was so surprised that he was coming over. Right. But then she had this moment of like, this actually is so great because he's really sick. He was in his crib. She wanted to put him in the car. And then my sister and I were there. Right. I mean, my dad was at work, I guess. Like, I just remember she didn't know what to do with us. We didn't really know anybody.
Right.
And he was sort of like, why would you bring him out? He's sick.
Yeah. You're like, yeah, that makes sense.
Makes a lot of sense.
Yeah. So, I remember you bringing this up when we worked on labor and delivery, and we were talking about like why we can't just like provide care in the home, and you were like, oh yeah, this is how you
guys should see us at 2 a.m. at the nursing station.
We were like manic, but
manic on Diet Pepsi and coffee.
Yeah. And she's like, oh yeah, I mean, it makes sense. Like, when I lived in Belgium, like, the pediatrician just came to my house, and I was like, what are you talking about? And she was like, no, that's how they did it. I was like, huh, okay, that's kind of cool. And then it's, snowballed into this, like, all right, well, that actually does make sense. Like, why would you bring your sick kid to an office?
But also,
or why would you bring
a newborn?
Right. Or vice versa. Why would you bring a healthy kid, newborn, well child, whatever, to an office where they're seeing sick kids too? Like, it makes sense in the inverse. Like, one's got to give.
Right.
It feels like.
Right.
And then it did sort of like then snowball into okay, well, why can't we just go to people's homes then and help them take care of themselves and their babies after delivery? And that's sort of where this concept for naps came from. But then it's still like, if you can think about it, lactation's the same thing. Like, I think it's, I understand from a business perspective why it might make more sense to have people come to you and see more people.
Patients, totally. Yeah.
But like, if you're thinking about lactation, it's like, no, like having somebody come to your house and you don't have to figure out how to leave with your baby or go to an office or whatever.
So even just learning to breastfeed.
That's what I was gonna say.
Like you need to be in your chair, on your couch, like with your pillows.
Yeah, like how are you doing it in your home?
Right.
Right. And then I feel like then it sort of spiraled into, I mean, over the years now, we're talking, you know, over the last like 11 years, talking to other people, but you've had like, so you have so many contacts.
I started reaching out to people that I knew who like, I know have had babies and live in other countries.
The Australian one is wicked cool.
The Australian one's so cool. This is actually my sister's friend.
Yep.
But basically she said when she delivered, before you got discharged, I mean, you got a number of things like set up with your discharge paperwork. And one of them was like getting enrolled in a new mom support group by your zip code. It's like the government had it set up in the healthcare system.
They were like, here's your group.
Yeah, here's your group based on where you live.
It starts.
Right. She also had, I wish I had more information on this, but maybe people listening who know this can like message us and tell me more. There was a sleep clinic.
Yeah, I remember you talking about.
And it was set up to go, you would go with your baby at certain stages. And nurses would help overnight with the baby so you could sleep.
Yeah.
But then they would teach you about sleep to get your baby to sleep longer.
Yeah.
Because I remember she would tell my sister, I'm getting so excited. I'm going to be going to the sleep clinic soon.
Yeah.
Sounds awesome.
Right.
The Netherlands has like up to almost 2 weeks when you go home. A nurse comes every day to your house for like long stints, like 3 to 8 hour stints here. To do everything. It's not just about breastfeeding. It's like feeding and sleep and newborn care. I'm pretty sure. Maybe I'll just spout out all my collections.
These are like Emily facts that need to be checked in Google. No, I'm kidding.
Listen, this is my friend who lives there. I believe it.
Like 3 to 8 hours.
Yeah.
I'm just fucking.
It's a long. It's not.
No, it's not like an hour.
Here's what I was thinking when we launched Day of Discharge, this new service, which we'll tell you about. Which is where a nurse comes into your home for 4 hours. But in my research to launch this service, I was asking patients about how long nurses saw them.
Totally. The VNA.
15 minutes.
Yeah, the VNA is like
minutes.
a 15 to 30 minute check.
That's like nothing. What do you can do in 15 minutes?
I was at my friend's house after she had her second or third. And when the VNA came, and it was definitely no longer than 30 minutes, probably a 20-minute visit. They'd like weigh the baby real quick, listen to the baby's heart and lungs, maybe, and then like did an incision check on her.
You're basically looking to identify in 15 minutes a really colossal problem and then leaving if it's not. Like,
no education, no support. God forbid you start crying as a mom. Like they gotta go.
Don't cry. There's not enough time to help you crying. Yeah, for sure. Hold it in.
Oh yeah. But no,
it's terrible.
Yeah, I mean, and I feel like with that concept in the Netherlands, think about if you had a nurse checking on you every day, even if it was for 2 hours.
Right.
You know what I mean?
Right.
And just providing that, like getting to know you, providing that one-on-one support, like checking in on you as the parents, like both parents.
It's the continuity of care too.
100%.
It's not just a one and done, which is what we do right now. You have a baby, you have like 30 visits when you're pregnant, some less, some more. But like that's a lot of visits, and then you get one after the baby comes. Our nurses will commonly say, like in a lactation visit, they have up to 2 hours.
Yeah.
And they'll say, like, I could have gone all day.
Yeah.
And I'm like, I know, but you can also only retain so much
as a parent.
Yeah. So it's like the continuity, like, let's just actually see you more often and help you through this time.
Yeah.
Why would you want to cram everything that you need to know for the rest of your life about this baby?
And try and do it in 2 hours.
In 2 hours.
Yeah.
It's crazy.
Yeah. Yeah. And then, I mean, you were talking about like when you get discharged and having only the one visit. In France, you get pelvic floor physical therapy.
It's got to be in other countries too. They give you a prescription.
Right.
A prescription to get them.
I mean, we talked about this before in this concept of like having a baby, or let's just talk about let's just talk about C-sections. Like, when was the last time somebody had a major surgery like that was an incision the size of a C-section incision?
Yep.
And you didn't get physical therapy.
Well, I always
the day after or following.
When he tore his labrum, the doctor was calling him every day. He saw his PCP. He saw the ortho doctor. He had physical therapy multiple times a week.
Hip replacements, knee replacements, shoulder surgeries, fucking Achilles surgery. I mean, you have somebody checking in on you, like telling you to rest,
making sure that your pain's okay.
Yeah, you have physical therapy. I'm not saying
getting back to your daily activities.
Like, and I'm not saying that those. I wanted to be clear on this too. Like, do I think that we can probably do all of those like ortho surgeries a little bit better? Yeah, probably. But that's not what we're talking about here. Then you have a baby. You have a C-section. Or you have a baby and you have a tear, a perineal tear, and you got nothing. Got to figure out how to do all your activities of daily living on your own.
Yells for the nurses.
Manage your pain on your own. Yeah, you got to figure out how to get in and out of bed or sit up.
Take care of a fucking human.
And be up every 2 to 3 hours. And the best case scenario, to take care of another human being. Yeah. And get in and out of the house to go to appointments for said human being.
A lot of pediatrician appointments too, which is good. It's good to see the pediatrician.
Or you're not supposed to drive or lift anything heavy.
Right.
You have to go there and there's
the baby gets so many appointments.
No, I know.
The mom's getting nothing.
Right.
Yeah. Crazy.
It's fucked up. Anyway, I feel like we started off this company with this concept of like, how can we just do it a little bit better? There's so many different approaches you can take to this, right? Obviously, we're taking the approach of like, let's just go in the home, do it for people.
Right.
I would love one day for our services to be covered by insurance companies.
Like all services.
Yeah.
That'd be amazing.
Yeah. And because we know it's crazy, right? Because we know through research that having lactation support, peer support, proper prenatal and postpartum care decreases
sleep.
Sleep support decreases mental health issues, increases overall like outcomes for mom and baby. Like it's so we know all these things through research, yet
spelled out pretty clearly in a lot of research. Actually,
yet we're not providing that level of care for families,
right?
And so in our latest adventure in NAPS, just adding more services.
I like to add more services.
Emily does. I like to try and take away things, not take away.
Not a bad way, just really make it like sleek and But I'm like, let's do something else. And now it's day of discharge.
Yeah, which I'm like 100% behind.
It's different from a lactation visit. It's longer and it can cover feeding, but it's like a postpartum wellness check for mom and baby. It's the VNA, what I wish it could do.
What it should look like.
Yeah, what it should look like, which is mom, right? Like a proper mental health assessment. And then when you score, hi, like, what are we doing about it? Who are we referring you to? Like, how are you doing with that? Not just like throwing the paper in the trash and then like nobody ever talks to you about it.
Right.
Blood pressure check, incision check. How's your bleeding?
Right.
Looking for signs of preeclampsia. Like some women have gone home early from the hospital and then had complications after.
Right.
Feeding, breastfeeding, bottle feeding, pumping, getting into a schedule.
Yeah. And then all the stuff that like maybe somebody did with you in the hospital, or maybe they didn't, depending on like how busy the hospital was, or what nurse you had, or like your ability to retain it in the hospital. I mean, I do this for a living, and I can remember the first 24 hours in the hospital. I was only there for 48 on the postpartum floor. I was just like, I legitimately thought I was in another world. I was so tired. Like it felt like I was watching myself do all of these things, but I wasn't actually there. Like, in what fucking state are you able to retain anything when you feel like that? In what world?
And then they give you a packet of a lot of papers.
Yeah. So it's like
It's very
going back
confusing.
through like the bath, the umbilical cord care, if your baby had a circumcision, that,
Yep.
diapering, the
Filing the
nails. I
nails.
was just gonna say the nails. It's always a good one.
Parents always get stressed about that.
Yeah.
Or like clipping their skin, so we're just file their nails while we're there. Show you how to do it.
Just reminding people about the warning signs and like what is
Mhm.
normal, especially related to the baby, right? Their breathing patterns, crying,
Yep. It's a lot of
hiccups,
education.
noises, like there's so much
Mhm.
stuff. And just like it is like I feel like a lot of the education in the hospital, and we've been there, we've done the education. It's like one and done.
You have to get
And a
it
lot of this
in
stuff,
too.
right? But a lot of this stuff, like in order to retain it, you have to repeat it. You know, so it's even
Yes.
just like hearing it again.
It's like when we teach nursing students.
Totally.
We tell them how to do it.
Watch one, do one,
Yeah.
teach one.
Yeah, watch
Yeah.
one, do one, teach one.
Yeah. Yeah, so it's just like that follow-up to that. And then
It pulls the whole family in too. So because they're
Yes.
there for 4 hours, they're checking on mom, they're checking on baby, but then all of this education,
partner,
who
family.
else is in the home?
Yeah.
Partner, grandparents, families. We can talk about swaddling and soothing, safe sleep, like how to get into that routine, how
Yeah.
much should you be feeding and when, so people can actually effectively help you too.
Making sure the parents are getting a break or
Yeah.
splitting up the nights or something like that.
So there's this nurse who's out there doing them now, and her favorite part of the visit is, I know, Lauren. Lauren, we love you. She's the first, she's blazing the trail here for us doing these visits right now. She's amazing.
Yeah.
But her favorite part is she calls it take 20.
Yeah.
So she gives the baby a bath, their first sponge bath or tub bath with the parents, but then she'll take the baby all packaged and, you know,
Ready to
cozy,
sleep.
and sends the parents out for
Yeah.
at least, they have to take at least 20 minutes
Yeah.
to go take a shower, go eat something, or just leave the room and just like, whatever, do whatever you want.
I mean, if you're a new parent, you're going to understand, or have been a parent, you're going to understand what I'm about to say. If you're pregnant and listening to this, you will understand what I'm about to say soon. I'm not saying that in like a dun 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 kind of way. But like when your baby like finally falls asleep, I feel like you're always choosing between eating,
Mhm.
sleeping, or taking a shower.
Yeah.
And it's like we talk about this with like our nurses, we talk about this with our lactation people. It's like if you have the opportunity to give a parent like the ability to do all three of those
Yes.
things, like
That's amazing.
it makes you feel so good as a parent to be able to do all three.
I used to eat in the shower.
What do you mean?
Our shower, you know, my bathroom
Yeah,
has
it
this
has
like
that ledge.
window, you can see the monument, and it has a big ledge. So if I had a short window, I would take my coffee and my bagel up. It's a big ledge, it's not small. Like it's like a
Oh
countertop.
my God.
Put my coffee.
How did I not know this?
Yeah, I've never told you this.
No.
Yeah, fucking eat when I'm in the shower.
What do you mean? Like you would step to the side and take a bite?
The shower is big, so like there's space to just like lean forward and eat, drink your coffee, lean back
You
into
just,
the
like,
water.
Chew and swallow and not get any water in your mouth?
I mean, it's just water.
Drink a soggy bagel?
I'm very efficient.
That's like some
We
pre-gaming
all
in the
know I
shower
choose
in college
sleep.
shit.
I was crazy.
Actually surprised you didn't just choose sleep. The other cool thing about Lauren and these visits is like we're the reason. I mean, I don't know if we all love the day of discharge name. If anyone has any creative names,
I know.
tag us. I'll take it now that you've heard the description of it. But I think that one, it actually says what it is, and two, I think it's important. Like while like we set it up with the idea in mind that I think the majority of people booking this would be people who are being discharged home from the hospital with their baby after 2 days after vaginal delivery, 4 days after C-section ish.
Or leaving the NICU.
I was just gonna say
Right.
the other piece of this is like the day of discharge could actually be like a NICU discharge.
Mhm.
Or the cool thing about Lauren is that she actually worked on the cardiac floor, children's. So like she has worked with like babies with cardiac issues, post-transplant issues, like, or post-transplant babies, I should say. not even
Oxygen
issues.
tubes.
Yeah, so like
Right.
she can do all of that too, which is cool. So it doesn't even have to be a discharge home from the postpartum floor. It could be being discharged home from a NICU, from a cardiac ICU, or even a step down floor if your kid had a surgery or transplant or
Right.
whatever.
Or you just had a NICU stay and they're
Right.
right.
Totally.
Because think about it, these parents could be in the
Could be a
NICU for
short stay or a long stay.
yeah, a week or
Uh-huh.
months, and then all of a sudden they're like, you can go home.
Yeah.
Oh my gosh, like what? And your baby doesn't need vital signs. They don't need like
Yeah.
monitors. They don't,
It's
you know,
weird.
it's really weird for those parents.
Like, I feel like the
It's like, what do you
NICU is
mean we just leave now?
right. The NICU is the only ICU that you're discharged home from. Usually there's a step down.
Yeah, step down unit.
Right.
Like you could have a step. I bet. I know some
NICUs
hospitals
kind
have.
of do like the feeders and growers, you
Yeah,
know, like
step
they
down.
move you to a different area of the
Yeah.
NICU, but you're being discharged home from the NICU.
Yeah, you are.
It's interesting. Anyway, that's our latest what? Venture?
Service,
Service?
venture. We're blazing the path for healthcare because my idea is that everyone would get this type of visit. Every person would get this type of visit. And then it's like, oh, you are struggling to breastfeed, but you just got home. Like you need a little more time. Like your milk needs to come in.
Yeah.
So we'll have a lactation person come and help you in a couple days.
Right.
Or you have a lot of sleep questions, and we can only do so much right now. Like let's talk about that next week and really guide parents through like those days and weeks home.
Or I think about all the questions that we get about the exclusively bottle fed babies, whether that's formula or pumping and bottle feeding.
Right.
Like you're told a really specific amount to give your baby in the hospital.
It's not a lot.
And nobody tells you when to start giving them more.
They're like, you can give them
15 milliliters.
and they might be like in a syringe too. Like it's like
and then you like get home and you're like, so my kid's fucking starving, but they only told me to give 15 mil, and it's like, no, that should get real fast, right?
Yeah.
Yeah. I mean, I would love to,
Just had it to go up volumes. Like,
totally.
No idea.
Right.
Right.
So anyway, this
we're really excited about it.
I am really excited about it. I actually think this is something I really want to improve the model here and then blow it up. But this is something where people can book the visit like within the first few days home, or I would say like within the first 2 weeks is probably anywhere the first few days, first 2 weeks is probably the most appropriate, just based on like
sweet spot.
Yeah, education type stuff that you're and wanting to be able to have like that somebody talking to mom then for the mental health stuff. I think is so important too. Anyway, so if you just have an idea for a name of this, let us know. If you are interested in it, the link to book this service is in the show notes. Or if you have somebody who would be like is pregnant and would be interested in this, or have somebody who did recently have a baby or just get discharged home, send this their way so they can learn a little bit more about it.
The reason that we're here today and that we've grown so much is because you guys are the ones who help us.
Yeah.
You do a service with us and you love it, and then you tell your friend.
Yeah.
Or you tell your family, or you listen to this and you're like, my sister-in-law's pregnant, right? And so just getting it to the people who need it the most.
Yeah.
So if you can do that for us
so we can,
one more time.
So we can scale this bitch and get this service to everybody.
And then it'll be so big that insurance will be like, how could we not cover this?
Yeah.
Because it's so big and effective.
That's what we're going for here, people.
We can't ever, if we can't go through something, Jamie and I just go around.
Yeah. Just going around.
Just going around, and we'll blaze a new pit.
We'll bring it back.
Yeah.
All right. We'll talk to you guys soon.
All right.
Bye.
See ya.